if there's any questions, maybe after namaz you can free to ask me. So, firstly, Rosa and Ramadan is very close to every Muslim, whether we are well, unwell, we want to do it. But there are certain conditions, as Mufti mentioned, you shouldn't fast, and a doctor's advice is necessary in those circumstances. I'll just briefly tell you what the effects of fasting and human body are. Your body needs energy to function, and most energy comes from food and drink that we consume. So a daily fluid requirement is 2 liters, that is about 6 to 8 glasses. That includes all the fluids. And a daily caloric requirement for an adult is about 1800 to 3000. It depends on your woman, man, and whether you're working and your age as well. So, mashallah, Ramadan is coming, and alhamdulillah, we are all ready for it. Because it's in summers, we've got 17 to 18 hours of fasting in which we are not going to consume any food and drink. We'll only have about 4 hours of eating and drinking. So we have to look after ourselves and to be able to do it properly. So there are spiritual benefits which Mufti Sahab has already mentioned. I see fasting also, there are medical benefits if it's done properly. So it's a bonus for us. We can lose weight while we are trying to do fasting, and weight loss is got its own benefits. It can prevent heart disease, it can lower your blood pressures, cholesterol, and also prevent diabetes. How it affects us: when we are fasting, our energy levels are low, we start burning out fat, and that produces energy for us to function, and this results in weight loss. It also controls your blood pressure and brings your cholesterol down, and it helps our mental well-being, depression, anxiety, what we call as damagi sukoon. It helps us to give us a self-control. So if we've got any bad habits like smoking, we can start thinking of it now and make a commitment to stop. And there is help available. Yeah, there's a number there, and you can ask pharmacists and doctors who can guide you to it as well. So we can, if there's a will, there's a way. So we can try and quit smoking in this month. There are medical problems during fasting which can be encountered by unhealthy eating, गैर सेहतमंद खाना जिसे हम कहते हैं. Some of us feel that okay, we'll just have aftar, not have suhoor, and missing a meal is probably not healthy, and it's not beneficial for human body. So what we suggest as doctors is that we should have suhoor and we should have aftar as well. We don't drink enough fluid because it's only 4 to 5 hours. We are just consuming maybe 2-3 glasses of water because our stomach cannot hold. So what I would advise is just take smaller amounts through the 4-5 hours to equate to about 1 to 2 liters of fluid. 1 से 2 लीटर पानी कंज्यूम करें. किसी भी चाय हो, कॉफ़ी हो, जूस हो, शरबत हो, सबको मिला के 1 से 2 लीटर पानी कंज्यूम करें. Ramadan, because of Ramadan, we are namaz schedules, roza, tarawih, our sleep is disturbed, so we don't get enough rest. Not having enough rest is also not beneficial for health. 3 things are very important: fluid, food, and sleep. If you don't have these, it will drive you mental, basically. So it's important that we have enough rest as well. So if we are not sleeping through the night, have maybe 1 or 2 hours rest during the day. The commonest problems we encounter as doctors in our patients in Ramadan is indigestion, heartburn, commonly known as tezabiyat or gas ka problem. And this is due to increase of acid in our stomach. There's food which we are consuming is spicy, oily, fried, fizzy drinks, too much tea, coffee, smoking, and we should avoid this. And if you have this problem, try and contact a pharmacist. There is a lot of things you can get advice over the counter from the pharmacist. There is a minor ailment scheme which you can access as quick and easy as well, and a lot of things are free to access and confidential as well through pharmacy. But if it persists, then you should speak to a doctor. Headache is a common problem because we don't drink enough, not sleeping enough, and this can lead to headaches. Again, if you're addicted to smoking, drinking tea, coffee, which can lead to headaches as well. So try and avoid rigorous exercise. If you've got a headache, take some paracetamol. That's the quickest and easiest solution to it. And drink plenty of fluids. Avoid dehydration, as I mentioned already. Weather is going to be hot. Try and drink at least a couple of liters of water or fluids, 6 to 8 glasses in those 4 to 5 hours you've got. Constipation or kabaz is another problem we face. It's because of lack of fluid, lack of fiber in our diet. The pakoras and the samosas we are consuming, kebabs, so try and avoid those. If you have a problem, then you can ask the pharmacist. Again, there are a lot of laxatives available, treatments available, which you can access for free from the pharmacist rather than going to a doctor. But if the problem persists, I would suggest speak to a doctor. Try and increase the fiber in your diet, like fruits, vegetables, bran. These are types of fibers you can easily consume. So we are aiming for a healthy diet, which is a balanced diet with fruits and vegetables, bit of starch or carbohydrates, protein, and bit of fat. So aim for what to avoid. So deep fried pakora, samosa, falafels, dumplings, mithais, gulab jamun, baklava. Moses, you have to be careful. High fat. The commonest error we make is having a paratha because it's very filling. It's probably not a good idea to have parathas in Sahri. And try to have a dry chapati, because the benefit of that is it's going to last longer in your stomach, and it's not going to cause gas problem or indigestion. Avoid fizzy drinks altogether. Try and have, maybe if you're fond of sharbat or something, you can have squash. Try to have some squash, and water is probably better. What to eat? So rice, pasta, couscous, these are all types of carbohydrates, and they are good to eat in Sahri time, because they would last you a good while through the day and give you consistent energy. If you want to have a samosa, have a baked samosa, baked falafels, milk-based puddings, and mithais you can have, but content of sugar should be less. Have fruit juice, milk, yogurts. Try to grill your meat, chicken and the lamb you're consuming. Try to grill them. Shallow fry is also acceptable. So chapatis without oil. Consume some milk, yogurt, because they're going to reduce the acid in your stomach and prevent indigestion. So there are some meal plans. They are easily available, but try to include water and dates in your diet, because they're going to be healthy for you. Dates are very beneficial because they've got high iron content. They can last you long, giving you energy all through the day. So there are certain conditions in which we as doctors have consensus that we should advise our patients not to fast. There are two types of diabetes. There's a type 1 diabetes, which is usually in young people, in children, and as you grow older it stays with you, and this is an insulin dependent diabetes. So people who are using insulin from childhood, we advise them not to fast, because it can be muzir health, and it can cause a lot of in certain conditions it can cause medical emergencies as well. So if you're on type 1 diabetes and you're using insulin only, you should not fast. There are other types of diabetes in which you can fast, but you have to make some adjustment to your medications. You should check your blood sugars multiple times.
Can I ask you? If it's type 2 diabetes, you said if they take an insulin, they should make some adjustment.
Yes.
So they need to visit their doctors now and make adjustment now.
Yes, I'll come to that.
Yeah, please. Could you explain that?
So if you are on certain medications, so if you're on insulin or you are on, we call it hypoglycemic, there's a medication if you're on called glycoside. These are the two things you should check your sugars if you're fasting multiple times in a day, because they will put your sugar low. You should avoid too much sugary and fatty food. Drink plenty, and always think of low sugars. Whenever you feel dizzy, clammy, sweating, you should always check your sugar first. Avoid any strenuous exercise while you're fasting if you've got diabetes and you're on medication. The bottom line is that if you can't do it, don't do it. Because as Mufti Sahab said, you know yourself better than putting, yourself on, in front of a Mufti and exaggerating your condition. You know yourself better. Sometimes, as Mufti Sahab said, you can find excuse not to fast, but at the same time, there are people who should not fast, find excuse to fast. That's also dangerous as well.
Yeah, that's it.
So we see a lot of people coming to us and they say, we are fine, we can fast, and from their medical records, we can tell that they're not actually. So you know yourself better than anybody else. So if you are capable, you should do it. If you don't feel capable in yourself and your doctor is advising not to, listen to your doctor. So these are the recommendations as I mentioned. So patients who are on diet and have no medication, they have got, like, you can call them newly diabetics or borderline diabetes. They can just have diet control, so there are no changes to be made. They can fast. Patient on oral hypoglycemics, these are the patients who are on insulin or they are on glycoside, the oral medication. They should speak to the doctor because there are adjustments needed which you can't do yourself. Speak to your doctor if you're on insulin and glycoside. If you're in metformin 3 times a day, you can just take morning and evening and skip the dose in the middle and you can fast. Again, there are other medications. If you're not sure, speak to your doctor. With all the medications, you should make sure you are drinking plenty. Aim for about 2 liters of fluid in a day. That's very important. Again, after diabetes, commonest thing we see is asthma, and people ask us what to do if we are asthma. You can fast if asthma is well controlled and you're not needing your inhalers through the day. You can fast. Do not stop your medication when you're fasting, because the asthma is a preventative disease. So the medication you are taking, the brown pumps you're taking, is prevention. So if you stop them, you're going to have asthma attack. Not on that day, maybe a few days later. So try and make sure you take your pumps regularly, especially the brown pump. Drink plenty of fluids. Again, the same thing. Exercise may trigger asthma, so prevent doing any exercise while you're fasting. Carry your inhalers with you. If needed, in emergency, you can break your fast. Mufti Sahab would probably give some, advice on that. If it's an emergency, you're having a breathing problem, chest pains, you can break your fast and treat yourself first, and you can make it up later. So bottom line is, look after yourself, eat healthy. If you've got a medical condition, speak to your doctor, get some advice from the pharmacist. Even nowadays, pharmacists are well trained. They are providing minor ailment services. So these are minor ailments. You don't need to go to your doctor. Quick and easy advice is to access your pharmacist and get some advice, or indigestion, constipation. These are common problems. And if you have any problems, you can speak to your doctor.
एक छोटा सा सवाल, वो पंप जो है वो तो दिन में कई दफा लेना पड़ता है, तो रमजान में क्या करें?
तो जो ब्राउन वाला पंप है वो सिर्फ 2 ही दफा लेना पड़ता है, सुबह और शाम। अगर आपको दिन में कोई पंप इस्तेमाल करना पड़ रहा है तो इसका मतलब आपका अस्थमा कंट्रोल नहीं है, तो आप डॉक्टर या नर्स के पास जाएं ताकि वो आपको एडवाइस दे सके। जो अस्थमा की ट्रीटमेंट है उसमें 2 किस्म की ट्रीटमेंट होती है। एक पंप जो 1 दफा दिन में होता है या 2 दफा होता है, तो आप डॉक्टर से मशवरा कर सकते हैं कि वो आपको चेंज करके ऐसे पंप पे डाल दें जो दिन में 1 ही दफा इस्तेमाल करना पड़े। तो उसके वो है, मगर ऐसा कोई ट्रीटमेंट नहीं है अस्थमा में जो दिन में भी इस्तेमाल। दिन में सिर्फ आपको ब्लू वाला पंप इस्तेमाल ज्यादा करना पड़ता है अगर आपका अस्थमा कंट्रोल नहीं है। तो कोशिश करें, अगर आपका इस्तेमाल कंट्रोल नहीं है तो आप डॉक्टर से बात करें और नर्स को देखें ताकि आपकी ट्रीटमेंट एडजस्ट की। जज़ाकल्लाह।